This episode of the Better Every Shift podcast is sponsored by MagnaGrip, America's choice for clean air. Eliminate 100% of airborne toxins from within the station with MagnaGrip. Learn more at magnagrip.com.
Hey everybody, welcome to the Better Every Shift podcast. My name is Aaron Zamzow. I am your host. Like it or not, hopefully you like it. I'm trying to get better. It's been a year since we've talked to our guest, and I hope I've gotten a little bit, a little bit better at what we're doing here. And I love this time of the year because it means it's spring, number one, and number two, I love this week because as an officer, you basically make my job so easy because I don't have to worry about taking care of any drills, at least for a month actually. And so with us is Chief Darren Wallentine, who is here to talk about Safety Stand Down Week. And Chief, welcome back to the program again. Thanks a lot for being here again. It's great to see you.
Great to see you too, Zam. It's always a pleasure, and just really look forward to this time of year so that we can get the word out about Safety Stand Down.
Well, you're like Santa Claus for fire officers in a way, because you work all year round talking to people of the fire service, trying to figure out what is the pertinent topic, what should we be covering for Safety Stand Down. And then once you guys decide on it, you put together some unbelievable resources. And I'm going to reiterate this website numerous times. It's www.safetystanddown.org. And you're back again to talk a little bit about that. But before I get into all that, I just want to kind of reintroduce you to people. If they haven't heard some of our previous podcasts, please go back and listen to those because they're very, very valuable for your organization. And we'll maybe hit on some of those topics that we did talk about. But, currently you're the Deputy Fire Chief with Sarasota County Fire Department, Florida. You're the at-large director for IFC's Safety and Survival section. You've been on this committee now. How long have you been the chairperson for Safety Stand Down?
So this will be my third year to be the chair for Safety Stand Down. I'm standing on the shoulders of some very prominent folks who come before me who did start off this whole initiative. So I'm very, very honored and very pleased to work with a great group.
And if you're listening, you're kind of like, oh, I've heard of it before. My fire department doesn't follow it. Doesn't matter if your department does or not. You should be looking at these resources. If you're a member of the fire service or even want to be a member of the fire service, it's a fantastic annual event. It's a joint initiative supported by several fire service organizations, fire EMS departments all over the country. As I said, should suspend basically your trainings for this week and activity and focus on the one topic, which we will reveal very quickly here. And the goal is obviously to reduce the number of preventable injuries and deaths in the fire service, and to make sure. I kind of like it, like the theme last year was you kind of get back to basics. You bring everybody back together on a certain topic. And Chief, without further ado, I'll let you reveal what the topic this year for Safety Stand Down is, which is.
So for this year, it's Break the Stigma, a behavioral health reset. So we are definitely tackling a huge topic in fire service, whether you're a volunteer or you are a professional firefighter, whether in firefighting or EMS, and even recognizing that we have others that we have to focus on as well, our dispatchers and anybody who's battling with the challenges of being in public safety, especially for a long career. So this is a topic that we definitely wanted to address after the last couple of years of other various topics that have been very important. So we are definitely have a lot of content and a lot of resources, and trying to pack that into 5 days of bite-sized information is the biggest challenge we have this year.
Yeah, we'll dig into the content. I've gotten a look at it. It's unbelievable. Very well done, by the way. So Safety Stand Down this year is June 15th through the 21st. But I highly recommend, whenever you're listening to this, go to the website, safetystanddown.org, and just start digging into the resources. They should be used and utilized through someone's career. Give me a little background. Why this topic this year, and kind of what went into, getting us to this point?
Well, I would have to say that every year we are really challenged amongst our 5 partner organizations, of which, between the Safety, Health, and Survival section of the IAFC, our partners over there at the IAFF, the National Volunteer Fire Council, which are huge partners and one of the original groups that make this all happen, as well as NFPA, and then the Fire Department Safety Officer Association. So we have a tremendous committee with a lot of different perspectives. We are very, very pleased and very honored to have them, along with us to help bring us content and to help get the word out to our nation's firefighters. And it's fantastic to have that opportunity when everybody's, going in the same direction and have the same focus. And none more, important, this year than the behavioral health conversations that are happening across the country. So it was an important one, but I know that you would harken back to last year's topic of, fire training back to basics. And then the year before that was the lithium ion batteries. Are you ready? So these have been very important topics. And so having seen some of the tragic stories coming out on behavioral health side of things, whether it's suicide or struggles with PTSD, those sorts of topics, are very relevant and something that we thought that it was important for us to address. So all of our committee was like, absolutely, yes, that's the thing we want to tackle. And yes, it's like, as soon as, June 21st comes and goes this year, we're going to be back at it for our 2026 planning for next year's event.
You talked about the behavioral health and the mental health and bringing all the different organizations in the same room with the same, kind of focus. How did that all come about? How did Safety Stand Down kind of come about way back when? And how do you really get all those organizations together? Because it's really cool when you look at how many organizations are part of it, how many sponsors. Man, everybody is going all into this, and you've done a great job of bringing everyone together. Where did that all start?
So many years ago, and I'm going to be challenged on what year that was, but it was quite some time ago that both the Safety, Health, and Survival section, as well as the National Volunteer Fire Council, came together to start addressing some of the things where firefighters are being injured or killed, and making it much more like what the military has done with, we're going to do a stand down. We're going to stop all operations. We're going to dedicate an entire week of topic of information that we're going to focus on, so that we can address those problems lying in wait, those challenges that we face, on the safety side of things. So prior to, the last couple of years, we've had other topics like traffic incident management, firefighters and EMS personnel being killed on the roadways. We had Dr. Richard Gassaway on situational awareness on various topics, that he came to the table. And what's really exciting about this year is not only having the IAFF and their collaboration and the SMEs from the Center for Excellence. We also have reached out to people like Sarah Janke and Jeff Dill, in the realm of behavioral health and mental wellness, to come to the table to help us put together all the content for the 5 days, of this stand down. So we're very blessed to have the network that we have, so that we can bring the most relevant information to our firefighters this year, especially on this very important topic.
And it is an important topic, very important. And I will say there might be some people listening that might be a little bit like, okay, enough with the behavioral health, the mental health. We're pushing it. I've had enough of it. I understand we're more likely to have issues with it. And to be honest, at first I was like, okay, yeah, we've talked a lot about it. Then I went to the website, and I got to tell you, I looked, and there is every single resource. And you're not only just talking about, how to identify, you're talking about how to, prep yourself for a long career in the fire service, how to build resilience, how to take care of those retirees and why it's important to check in. And there are just so many aspects that, I mean, personally, I've thought of them, but you've been able to put them all in a very organized fashion. And the website has been redone this year, by the way. So it's another reason for people to go, because it's not only good on desktop, it's really good on mobile. So well done there, Chief. Talk about, the reset, how that came about, and and again, why is this so important? Why we need to know this stuff. We also need to put it in an kind of a mantra and an organizational framework for every single firefighter to start, understanding what we're talking about here.
So, um, so any sort of plan that we have for the stand down, we wanted to make it so that it's in, small bite-sized bits of information. And so in our discussions of the planning committee, we wanted to make it so that it was very straightforward and structured. Last year we had the 10 pillars, of the fire training. We came out with the one pager. And again, as you had mentioned too, the website's been completely redone. It is fantastic. It's so much more, valuable to us. We even can go back in past years and you can pull out the data, and you can go back and get all the details on lithium ion batteries from 2023, last year's fire training in 2024. But honestly, when we started to go through this, I wanted to make this as simple as possible for our nation's firefighters, both volunteers and professional and EMS personnel, is to remember reset. We've had a lot of conversations in fireground tactics and UL and NIST and flow path and the things like the exterior reset or the attic reset. And so what we did was kind of combine what we already know in some of this. It's a mnemonic, which is the reset stands for recognition, education, strategies, empowerment, and then training. So each one of these days, there's a vast amount of content that people can go to. They can find things on resilience. They can find things on healthy living. What are the things that you can do, that will help keep you, in a good mindset. And then if you happen to, be challenged with some things, whether it's alcohol use, whether it's you're struggling with PTSD or traumatic calls that seem to be sticky, you can't shed them, there's things in there giving you more details about what you can do. And whether it's beginning at the very beginning as a brand new firefighter, progressing through your long 25, 30-year career, at some point, you're going to be looking at retirement. And that brings on a whole new, amount of challenges for our nation's firefighters.
So for an officer like myself, or for the training chief, or anyone who is, if you're on a volunteer or an on-call paid or on-call premise, department where, maybe you don't meet during that week, but you can set up and plan how you want to utilize each one of these days, or, like we were talking about, how to launch the reset. And I think the other part about this too is you guys address, and if you would, like, enlighten me a little bit about what the mindset was behind getting this out, because we know that peer support works, but the way that you guys have set this up is we want to educate you, and then we want you to really, like, share that message, right?
Yeah, absolutely. I mean, we're in essence, we're putting the ball on the tee and we're letting the nation's firefighters hit it, because whether you as a company officer or a chief officer who might be in another department, a training chief, training cadre, the information is all there for you to develop and to have that, either the crucial conversations or develop a training plan, or if your department is not performing some level of resilience, training during recruit class, it's an opportunity for you to build on what's already been done elsewhere. We have other other things like success stories that are built into the website, so you can see what other departments are doing, and then take and not have to reinvent the wheel on some cases. But really, it's merely we're leading you to the info, and what you go and do with it. We're trusting that our leaders in the fire service world are gonna, continue to have these tough conversations, whether it's at the kitchen table at the fire station or whether it's in an official training class, getting mental health first aid or some sort of psychological first aid courses to your peer support team in a training academy. That's entirely up to the department's, vision for their own, behavioral health programs.
When you were putting together all the resources, what was the biggest, I guess, surprise that you had? Was it the vast number of resources that were already out there? Was it, a lack of resources in one particular area, like, in the strategies section or education? Like, what kind of stood out as you were starting to put everything together?
Well, what became very obvious to those of us on the planning committee is that none of us on the planning committee are mental health professionals, are behavioral health professionals. We just happen to be passionate about, safety, and we have all had some level of interaction with our own departments, behavioral health programs. But what it was is that the sheer volume of content and information, our biggest challenge was going to be putting it into the 5 days of the stand down and bringing it down into smaller bite-sized pieces so that people can ingest it, and then they can start having conversations, and again, you go right to the suicide, conversations. That's a very tough one, but there's resources now that are going to help those, you know, those folks who, are having that crucial conversation with somebody who's having those thoughts, and then what they can do. So it's there's no shortage of content. It's just a matter of us now trying to organize it in the fashion under that reset, so that everybody has what they need.
Um, if someone sees something that's, hey, here would be another great resource to put, with safety, how do they try to get that resource to you? And are you guys are obviously very open to that kind of messaging, or like, open to that, correct?
Absolutely. Yeah, we have ways that you can contact us through the website. You could obviously, reach out to any of the partner organizations. I give out our contact information all the time. However you can get the information to us, we take everyone's recommendations on what we should be, focusing on for future stand downs. It's been a great opportunity to work with an amazing group of committee folks, none more than, our partners at the National Volunteer Fire Council. I mean, they are bought in 100%, and they come to the table, and always focus on, not just what volunteers need, but they recognize, because a lot of our volunteers are also professional firefighters at another organization or vice versa. So there's a lot of bleed over, but the resources at NFPA are just amazing as well. And so we're really blessed with a great committee group. So I keep putting stuff out on my social media, and folks will still reach out to me, whether through LinkedIn or through other avenues. But there's always an open ear to what we should be focused on for stand down.
Yeah, and there's just so much too. Chances are, if you're not seeing it, you just probably haven't found the right page or topic that it's on. To be honest, because I said this earlier. I was at a point. I'm like, okay, mental health. Boy, we've talked about this a lot, but you see this in the context of, the reset, the training alone. There's webinars there. There's roundtable talks or topics. There are actual courses that you can do, both individually and for your crew. Then there's webinars that you can attend or just watch as a crew. There's resiliency training resources. Every single agency, IFC, Fire Rescue One has some stuff on there. NVFC has a ton of resources. But like I said, what this is doing is it bringing all those behavioral health and mental health kind of topics and resources, and you're putting them into a very organized fashion. And I don't want to, and I don't say that like, hey, I'm kind of sick of it. What I'm really excited about is how you're putting together all of the different parts of it. It's just not about, sometimes peer support is awesome. Getting help and seeing a counselor is awesome, but it's a small part of the big picture when we talk about behavior health and mental health and physical health even. And so for you guys to put all this, in there, there's things on some nutrition. I see some fitness resources in here. I see some stuff for families. Let's talk a little bit about that too. I think that's kind of the forgotten partner, right?
So first and foremost, I wouldn't be where I am today in my career had it not been for my wife, for my family, for everybody who supported me, through my fire service career, all of the ups, all of the downs, sleep deprived, coming home. One of the things that really kind of jumped out at me, Zam, was I was on busy paramedic trucks, as a firefighter, and I would be up 24 hours and come home exhausted. And it was kind of a eye-opening and heartbreaking experience when my wife said, whenever you come home, you need to go to bed, because when you come home, you're not happy, you're angry, you're quick-tempered, which is all just indications of the carrying the stress of the career and the calls that you respond to, and maybe not having the ability to have a conversation with your wife about, the traumatic arrest that you responded to, because she may not want to hear all of those details. But honestly, there's a family that is suffering right alongside of you. And so as my career progressed and then was more in a position of trying to find the resources for our firefighters, whenever there was a committee to review shift schedule and what's the best shift schedule for our crews, it wouldn't be, the different ranks across the different shifts and the different tenures. I'd invite retirees to come sit on our committee, because they now have a different perspective. They are now sleeping every night in their own bed. They're not sleep deprived. They're probably eating a lot better. And now they have time to work out, with which we can try to create this whole holistic person, that can do all of the things necessary to stay mentally sharp and to deal with the behavioral challenges that you face in a career. But we would also invite spouses of firefighters. We wouldn't put them both on the same committee, because we wouldn't want to have those awkward conversations. But we would invite a spouse to come sit on our committee to give the family's perspective. So taking that into account, it gave us an opportunity to be able to, to make decisions and go directions that were taking into effect the, what's the impact on family. And so I think it's a key part, especially early in the career. If your department going through recruit training and you have families showing up, getting them involved from the very beginning is going to build that network. And so for that spouse that doesn't recognize the challenges of a 24-hour shift schedule, they now have a connection to other spouses who have been around for a while, so that they have the support network. Because oftentimes we're not always willing as firefighters and responders to come and talk about things outside of our group of fellow firefighters or responders.
Breathing in diesel exhaust fumes is like walking into a fire without a mask. Protect yourself with MagnaGrip, the easiest, most reliable exhaust removal system that features a true 100% seal to eliminate diesel exhaust fumes in a snap. Visit magnagrip.com to download MagnaGrip's free grant guide with expert tips to solidify a grant for essential safety equipment, such as MagnaGrip's exhaust removal systems. That's magnagrip.com to download the free guide.
It's a great idea to bring family members in, because I think, and I'll take this back to just the topic at hand, mental health. We as firefighters, first responders, like, we're not optimized a lot. We're not at 100%. We're sleep deprived, as you mentioned, and then we reach for high sugary energy drinks and foods because we're trying to find that energy somewhere, which makes us a little bit short tempered, and sometimes we don't listen the best because of that. Do you think, like, why we still need to, another reason we need to start pushing this mental health and continue to do it is because misery loves company, and when you're sitting at a table with 80% people that are just as tired as you are, there's nothing wrong, right, Chief?
Right. And so Zam, I mean, you're a company officer, right? So you have a responsibility, to be aware of what's going on, at your station for your crew. So you're going to be, I'm hoping, very attuned to what your firefighters are going through. Not that you're going to be specifically asking their business, about what's going on at home, how's your marriage going, but when you start to see some of those warning signs, somebody who's normally very, professional and compassionate, their affects start to change. Now they're not as professional, they're quick tempered, they're not treating their coworkers in the same vein. They might be showing up a little bit later to work than they normally do. They might be segmenting themselves off in that private dorm, which is always intended to be a good thing, where we can all sleep without hearing the snoring next to us in a giant bunk room. But when firefighters are in their bunk room by themselves, interact with other crew members, that's a huge warning sign for a company officer or a chief officer. So it's you being attuned to your folks. And that's where I think it's very important that our new company officers and those who are stepping up in leadership roles is to be developing those skills of interpersonal skills and having crucial conversations with their folks if it comes to it.
Well, that's the recognized part of it. And I think, a lot of us will recognize it. But what you guys do here is you also then say, all right, recognize it. We're going to educate you on why maybe those things are happening. But then here's the other part, the strategies. Day 3, how can you start to ask the right questions? How can you start to work towards getting that individual into a better place? And empower is also part about having people try to help themselves, and how we as a fire service have some things in place to help with that, and where to get help. And then, of course, your last day, which is, how do you continually train others to recognize those things? And you're totally right. Like, for me, our shift pattern is not the best for sleep. And when we call it the last day of our swing, I can tell that is not the day to go out and do heavy drills, heavy physical drills, because everybody is tired, and you can see it, especially if we had a really bad shift, the previous one. And what I've learned too, now that I'm into my 50s, I'm 51, and right, I don't recover as quickly, right, Chief? Like, we talked, I think, about that on one of our other podcasts. Like, the older you get, you start to realize, okay, sleep and the rest and trying to find that balance is critically important, not only just for your physical thing, the physical side, but this mental side, right? And so I think you hit a great point there, that we need to start, trying to have these conversations with people that aren't necessarily around us in the firehouse, outside of us. How is that affecting us? And we as a fire service like to think that it doesn't, right? Like, you remember those days you worked a 24-hour shift where a paramedic, at that time you had mentioned earlier, did you think you were fine?
Oh, I absolutely thought I was fine. There was nothing that was any different than any of my other coworkers who were going home,
Same, right?
exhausted from, and what's interesting is, I see it over my career, and I've seen it, from different perspectives, is that there's a type of firefighter that oftentimes is attracted to that craziness running at the busy stations, and then they don't recognize how bad it was until they then get out to a station where it's not that way. And then it's like, oh my gosh, why did I do that for so long? You know, because you're right. I mean, I'm 58. I'm pushing the big 6-0 here in a couple of years, and I want to stay fit and healthy, for my entire career, so I can enjoy my retirement, as long as I can. But it is a interesting challenge, because we often do it to ourselves.
Yes.
We try to stay in the caffeinated zone to keep us up high enough, but then there's those ramifications that come up where you're always in that zone. And then, oh yeah, by the way, through your annual physical, you got high blood pressure, or you've got other health conditions that are just, the side effect of being hyper vigilant and on the go all the time, as opposed to prioritizing your sleep, prioritizing your nutrition, staying hydrated, all right, and then being able to, work in a career that will actually just take and grind you down to a nub. So we're in it for the long game, and my mantra as a prior safety chief and now in my current position here at Sarasota County is that I want to see you be able to enjoy your retirement longer than the years you spent serving as a firefighter in this career. So if I've been in it for 33 years in the fire service, I'd like to see 33 years in your retirement, at the very least. So
Right. You work hard for that retirement or the pension or whatever, right. We want to make sure that you're getting that money out of what you put into it,
right.
physically, emotionally, and mentally. And, we're not just talking about behavior. We're talking about, really, when we say behavioral health, we're talking about life in general. Like, these are resources that are going to help you, in the firehouse, but they're also going to help you deal with some crisis with families, deal with crisis with relationships and health crisis. All these resources, as I go through the litany of them, there are things in here that are on sleep, that are on nutrition, that are on, the fitness side of stuff. And I think the other part that you guys did a great job with too, and that, you and I have talked about is, you have to really understand and maybe step back. And this is the challenge I think I'd like to hear our listeners do when they're looking and talking about safety stand down, is make that also a time where you really try to evaluate where you are personally. Are you doing the things you need to do to be at your best? I think that's one of the best things that you could take from this, right, Chief? I mean, we talk about optimizing health in general, and here's a bunch of resources that are going to help you do that. Is that one of the other kind of hidden messages you guys wanted to push out?
So I would say it's probably not so much a hidden message, but I think that there's a lot of value in having a self-assessment about, okay, what lens am I looking through this to get this information? Do I not recognize that I'm going to be, potentially dealing with the calls that I've responded to over the course of a 33-year career? Earlier in my career, a very busy medic truck where I've seen a lot of things that normal, people just never see, as it is with every other firefighter and paramedic and EMT across the country. I'm going to mention this. My wife, very astute. I had mentioned to her that I can't drive around the city of Tucson without thinking about the person who died at that corner, or driving past a building where there was a gunshot wound or a suicide or something that doesn't bring back the thought of that call. Somebody I heard once said, every traumatic event that you encounter is sticky. You can never shed it. It stays with you. It's how you're going to deal with it is the question, you know? And so when we moved to Sarasota, having had this conversation with my wife before, as we're driving through Tucson, she would ask me, so where do I go to find this restaurant? It's over by Station 5. Well, she doesn't know where Station 5 is. But I can tell you that as we're driving through the city, going places, that every single call that was a traumatic event was with me. So I know at some point that I'm going to have to process those things over time or be able to deal with them. But when we're driving through Sarasota now, of which I wasn't a paramedic on a busy rescue where I was responding to these victims, driving through Sarasota, those sticky events are not in my mind. I go back and visit friends in Tucson. Oh yeah. I know at the corner of Grant and Stone, I know what I saw at that location. So there's a self-assessment and there's a checklist that I think that would be very valuable. And I just want to let people know that before the stand down starts on June 15th, we will continue to update information on the website. You're going to see more and more content. Our partners with Science to the Station and Sarah Jenke and her team, we're going to have very similar sorts of bite-sized videos that you should see, on different topics. And so there's more to come. And that's why I thought it was important that we have this conversation well ahead of stand down so that we make sure that people know what's on the horizon and what's coming for the third week of June.
It is the third week of June, but that's live right now, correct? Like people can go to it and start, like you said, start finding some resources that you want to dig into more, maybe cover with your crew, maybe cover with your family, right? Like start, today to really start to look at them. Because to be honest, it's going to take you more than a week. It's going to take you a year to go through everything.
I mean, our biggest challenge is we've got so much content. It's going to take folks a while to get through all of it. It's like going to FDIC. You can't see it all, right? I mean, there's so much. It's like overwhelming. That's kind of the similar sort of an approach that we have this year for Stand Down. Is there's so much content, and we've got so many great people, that have a wealth of information that it's all going to be there, but it might take you a while to get through it. So you can get on the website right now and start going through some of the content in preparation.
And you do have links to the previous year. So this is going to stick around. Next year we're going to have you back, Chief, and we're going to talk about another topic, but this stuff still lives in now with that website. It's still going to be pertinent, just like back to basics fire training is, just like lithium ion batteries. Are you ready is pertinent. And so what you guys have really done, like I said, from an officer standpoint, you kind of like our Santa Claus, because you've just given me, 50, 60 one-page lessons that I can, transfer out. And there's no reason why, as an officer, you shouldn't use some of this stuff for drills. But even as a firefighter, if you're new to the fire service, a lot of times you're given assignments to do drills and to research stuff. This is a great go-to for it. And again, thank you guys so much for the efforts. I do want to know, just give me a little bit of a background into like, when do you guys decide next year's topic? And again, what then motivates you to get all the way through to this point?
So as soon as the stand down concludes this year, our planning committee will reconvene. We do like an after action, just like any good fire officer would have at the tailboard after, structure fire or some sort of incident. We kind of do a debrief on things, what worked, what didn't work, and what could we do to improve. So there were some things that we've taken from the past stand downs that we've implemented into this one. For going back to last year's stand down for the fire training back to basics, we actually reached out to all of our partner organizations. We put it out in the IAFC's website, KnowledgeNet, or the correspondence in the forums. We asked for our representatives to go back to their organizations to find out what topics, are the ones that they want us to address. No no big secret that of both the fire training, we start to see some increased level of injuries. We saw the deaths of those, in training events that make national news. And it was the year before, where we started seeing the significant increase in the rise of the lithium ion battery events. Our friend Frank Lieb and our folks at FDNY, who are battling high-rise, apartment fires where people are plugging in their mobility devices at their front door.
Mm-hmm.
Now they've blocked their only exit, and then we see the large loss of life in some of those incidents. Well, lo and behold, we had a series of suicides, in the fire service, that precipitated us having the conversation of which, the topic of behavioral health becomes much more relevant, much more important to address. So it was with that where we were able to mention at FRI last year that, giving an update to our section about the success of the training topic last year, that we would be addressing the topic of behavioral health in this year's stand down. For no other reason than we pay attention to what's happening in the fire service, in our EMS personnel, volunteers, professional, and whatever is relevant for the time are the things that we consider for our topic. And this was an easy choice for this year.
And then it's on. Then you're just like, where do we start? Right. Like, and where do we get those resources from? Right.
And then we start brainstorming, then we start putting together, what the topics are going to look like. And then we start trying to fine tune it. And that's where we developed the reset mnemonic to say, that we're going to recognize, we're going to educate, we're going to have strategies, we're going to empower our people. And then we're going to, provide training opportunities for folks to, to kind of reset this whole stigma of behavioral health, and if people are just talking about it now, then I would say that there's going to be a level of success that, we can lead people back to this site to get the information that they're looking for.
Yeah. Well, you guys did a great job with it, Chief. I know there's a lot of hard work and that's gone into it. And, probably some late nights and some late night emails and texts. And, what's the big motivator for you?
So just after 33 years in the fire service, the motivator for me is just there's lots of individuals that you encounter over the course of your career. There's people who are your mentors. There's people who, that are the reason why you do what you do. Again, my wife, my family are a big reason why, I'm motivated to preach the safety, aspects of the career. Again, for a safety officer, you've got three main categories. You've got cardiovascular health, you've got cancer prevention, and then you got behavioral health. That's the three-legged stool, that you can think of for any safety officer, and the things that are the big items that you'll face. So they're all interrelated. A cancer diagnosis is going to have a connection to cardiovascular health, and it's also going to have a connection back to behavioral health and mental health. A mental health diagnosis or some sort of behavioral health challenge, we know that some of these things, especially in a 24-hour shift in a fire service career, your immune system is oftentimes affected as a result of not getting enough sleep, being hypervigilant, and not being able to mentally deal with the challenges of the career. So you can't have one conversation without having a series of other conversations, which is the same about cancer prevention. You can't talk about cancer unless you talk about diet, exercise, and the things that you do to try to, control the things you can control. because there's a lot of things that you can't control.
Yeah.
So
Yeah.
same principle.
So really, it's just paying it forward, right? Like 33 years, you've had so many good lessons, and it's one of the reasons, same motivator why I love doing the show is because for me, it's a way to have great people on like yourself that have worked so hard to really try to pay it forward, and then it's a challenge then too, as I like to call our listeners, the misfits. So it's a challenge for you misfits to not only utilize the resources but share them with the crew, with your own, with your own department and with your own kind of circle to help them understand a little bit more and for them to get better. And comes down to a great segue into, the final question I like to ask our guests, Chief, is, what are you doing personally? What are you working on to get better?
Oh goodness. Besides living in Florida and
Right.
enjoying.
Right. Yeah. By the way, Chief hasn't aged in a year. He looks actually
Months.
younger this year. I don't know how he does it, but maybe it's that Florida, that air down there.
Uh, well, I would say that like every good Floridian, I'm seeing my dermatologist every 6 months to make sure there's nothing happening on that front. You know, I mean the work, whether you're a fire chief in a metro department or you're a fire chief in a small department or you're a deputy chief, a battalion chief, regardless of what your position is, it's being aware that you're not Superman, that you can't carry it all, that you have a team of people that that you need to rely on. But if you're not able to be mindful and healthy and prioritize the things that's going to keep you on the tracks to having a healthy career, it's mind, body, and spirit. So it's like, are you learning something every day? We talked about last year, every day is a training day. This year is, we're trying to break the stigma, and if we can have some crucial conversations with folks and steer them in the right direction, like you said, paying it forward, you never know who's gonna be listening and maybe decide that they're going to seek some therapy for the traumatic events that they've encountered, or they're going to be the next champion of whatever the topic might be. In essence, mentoring those that they're gonna lead the fire service in the future. So that's my take on some of that.
Yeah. So you're working on the biggest thing for you to get better is to focus on those things yourselves and transfer it on. Is kind of what you're doing with the safety stand now message. You of course gave us a lot of great nuggets to focus on. You gave us a great resource with the safety stand down this year. Again, make sure that you are transferring this knowledge on, absorbing it. You can get all the information at safetystanddown.org. This is a great time of the year to not only do a reset for your crew and to use that mnemonic to recognize, educate, understand strategies, empower yourself, and train on behavioral health issues, but also to look at yourself in the mirror and figure out how you can use the resources to make yourself better. Because in essence, that's what we're about in this program. We're about learning something. We're about doing something, sharing something to make you and those around you better every shift. Thanks for being here, Chief, and thanks for listening, everybody.